Hello, this is Kristan Weisdack, the CEO and founder of BehaviorWorx of Southwestern PA. With me today, I have an incredible gentleman I've had the opportunity to work with over the last couple months, Dr. Hans Lessmann. His practice, the Vision Development Institute, is located in Swissvale, local in Pittsburgh, and I walked into his office one day because I was fascinated with what he does, and I ended up working there just because it's really quite incredible what you do there. So the one question that I wanted to ask is really what do parents and professionals need to know about vision that pertains to reading and overall academics?
Well, great question. And thank you, Kristen, for your invitation to talk about reading or vision, which is my favorite subject. And the three things they need to know is number one is vision is more than 20/20. Okay. And it's important how you see as much as what you see.
Mm.
And third, vision is very important with reading, and it is a learned process. So vision is learned. So the good news there is it can improve. Okay. So let's talk about how you see versus what you see. So what you see is what a typical eye exam would look at is your uh, your visual acuity. Can you read the letters on the chart? And are your glasses adequate to do that? The the cruel thing about visual acuity, if you're going to relate that as like a single factor in academic performance, and we all know this, that those kids with better acuity do poorer in school. And we all know the smart kids wear glasses. And so it's not entirely true for each individual, but if I was to predict academic success by visual acuity, well, the poorer the visual acuity, generally the better the student.
Hmm.
And so in schools, they do the vision screenings and they send out all the kids with poor acuity, but those are all the good students by and large, where the kids who pass the test really should be referred out. Because most juvenile delinquents, interestingly, have 20/20 vision acuity. And so that's number one. So the problem is they go to the exam, they get a reading, a measurement of 20/20 acuity, and it says they're okay. The only problem, they're not doing well in school. They're not reading well.
So
And
explain to
so
people, because some people might not know what 2020 means. Can you explain that to people that might not know?
um, 20/20 is just visual detail, and it really just describes the integrity of the end organ, our eye, and is the neurology and the optics sufficient to see clear detail?
Mm.
And that it's a standard that in a healthy eye, you should be able to see 20/20, even 20/15. Few people see 20/10. Those are smaller letters.
Mm.
That's all. Okay, but that's a standard. And so I would expect in a school screening, 20/30 is the cutoff generally. But with many of the kids that I see, if they're seeing 20/30 or 20/25, they're uncomfortable and they're not seeing as well as they can. And so they may be misreading the board or missing assignments. If it's up on the board or now online, they may be missing it on the computer.
Mm.
Okay, so that's good question. So beyond the acuity, what are the other parameters of vision that's important in how you see? And one, really, can you track with your eyes? Can you aim them? Can you fixate them? Can you fixate them together? And then can you focus them together in an efficient and accurate and sustainable way so that over time, your eyes don't tire out, the words don't run together, you don't see double, you don't get headaches, uh, you don't get irritated. Okay, and so a lot of these kids, it actually hurts to read because physically their eyes just don't work that well together, and it hurts. And so they avoid reading, not surprisingly, or they tough it out and become real miserable. Either way, it's a problem. So that's eye coordination in how you see. And the other part of how you see is how you perceive. How well do you perceive the letters? Can you differentiate those and the spaces between them? And so many kids have difficulty with visual perception, so they see the word wrong to begin with. And so oftentimes it's very hard for them to sight read because they look at different parts of the same word and see a different visual presentation, even though it's the same word. You know, and today with computers and different fonts, then you add handwriting to it, it becomes even more visually confusing. So if a child has what we call a visual thinking deficit, then they're misperceiving letters, numbers, words, spaces, paragraphs, and it's very tedious and error prone to read. And this is why vision is so important with reading. You got to get the eyes to look at the page in a comfortable and accurate way, and then you got to understand what you see.
Yeah, the services that you offer are incredible, and that's what that drew me to even look into this in the first place. So what are some common signs and symptoms that a kiddo might be having visual problems that might prompt them to come see you?
Well, the best thing is they're a poor reader. So if you got a poor reader in school, let's rule out a vision problem. Okay. So pertaining to the third aspect, the other third aspect is the vision is learned. And so you can teach them how to see better. But beyond that, sometimes just a really good pair of glasses, carefully prescribed. And we have special lenses that we call them stress relieving or performance enhancing lenses. And those are really important for the poor reader because it can help focus their eyes. And so glasses are really important for the child that needs them. But not all glasses are the same. So you have compensating, and this is confusing. You have compensating lenses for nearsightedness, farsightedness, and astigmatism. But sometimes we prescribe lenses for reading, that they're just for reading lenses. So
yeah, that it just fascinates me because I mean, in the office, it's not just you're talking about working on a computer and writing and all these things. And it's not just working with kids, it's the adults too that you work with. And so, I mean, there's a wide range of people that come to see you. So talk about how not just young kids, but as kids get older and into adulthood, some of the problems that they may be facing. Because one of the things that we have people talk about is, you know, double vision or blurred vision or trouble driving at night. So let's say that there's some adults that are watching this. What are some signs that they might have some vision issues as well?
well, repeated visits to the eye doctor and unsatisfactory glasses. So the glasses don't work. You won't. And that we should differentiate different types of optometrists and eye care professionals, I guess. So you have the opticians who make the glasses. You have ophthalmologists who do surgery on the eyes. You have optometrists, which is what I am, that do eye exams for glasses and screen for eye disease. And then you have developmental optometrists who look at, and they're also called behavioral optometrists, that look at how one's behavior may be influenced by their visual status. And so a big thing, buzzword today, and it's been for many years, has been attention deficit. And so many symptoms of a vision problem mimic those of ADD, ADHD, compulsive disorders, and spectrum spectrum kids.
Hmm.
So it's really important to rule out a vision problem that you can deal with, that maybe you can resolve, as opposed to compensating, and you're quite familiar with behavior modification, how to work around the problem. And so one of the things with schools is when they have an issue, they find a weakness, they work around that and target the strength, which makes sense. The problem is you can only go so far. And once that kid's tapped out with that strength, you got to deal with the weakness. And so as developmental optometrists, we focus on the weak areas because you're only as good as the weakest link. Build that up such that they're they have a more even profile and more balanced profile developmentally. And that generally helps them to perform more to their expectations and others, and really reduces a lot of frustration. Because if you have a kid that's high in one area and low in another area, every time you hit that low area, they seem smart and then they do poorly. And what inevitably happens is that people blame on attention or motivation. Well, you're just not trying hard enough, when in fact they are trying hard. They just have an area of confusion that is unbeknownst to everybody else.
Yeah, and that's the point that I try to make in my trainings too. It's not that the kiddo won't, it's that they can't. And
Right.
so I think that's why collaborations like ours need to happen more and more often, so
Absolutely.
that people have a more holistic view of behavior, to say that, it's not just it's something without outside of the kiddo's ability, and it's outside of that individual's ability. And really taking a look at vision, and connecting with the right people to look at nutrition, balancing the gut, balancing the brain, the vision. And it was fascinating to me when I learned the anatomical connections between the visual system and the vestibular system and the auditory system. So motor planning and auditory processing, and how that really all works together. It's really all connected. Yeah. Yes, it's amazing.
Yeah, it's linked. Well, getting back to what you talked about with adults
Mm.
and what are the things they look at. So the big things that we see there is first of all, they can all have all the same problems as kids have.
Mhm.
They're no different in that regard. The other thing is it's big now is concussions. And this is true for kids as well as adults, and auto accidents and things. And that can really scramble what you see and how you see in the areas that we talked about. But also strokes, and you get field loss and things like that. So in the adult population, it's really tricky because here you had a capacity that now is fouled up, and you don't know that it's fouled up, especially in the visual how you see. And so you don't, like, and we got patients that can't plug appliances in because they can't differentiate the thick plug from the thin plug, and can't turn it around so they can plug it in. And that's really frustrating.
Mhm.
Okay, when you can't plug in an appliance and it should go in, and you just don't understand anymore visually that you have to transpose it or rotate it. And so the other thing with computers is if you have slow tracking or poor tracking, you can't follow the mouse or a spreadsheet. And in many of the jobs today, that's key to your performance capacity, is to be able to read those spreadsheets and use a mouse. And if you can't click on what you need to click on, you got a big problem. Okay. And a lot of them come in with headaches, fatigue, and they make a lot of mistakes, and they perform way below their potential. And it's embarrassing, but it's also an economic risk that they can lose their job, or they get demoted, or go on disability. Either way.
Yeah, one of the things that I remember one of the patients saying, and she was, I think this was a mom of one of the other patients. She had said she has trouble with like visual spatial awareness, like even when she's putting away leftovers, she has trouble determining what size container to get.
Yeah.
And so it's like visual spatial processing. And so a lot of these connections happen not just with the kids, but the adults start making those connections too. So whenever they have their kiddos in the office and they're like, oh, is this something I should work on too? So, I mean, like you said, plugging things in, being able to put food away correctly. It's just so many aspects of your life
Right.
are changed.
Right. And so what you're talking about there is visualization, which
Mm,
we call visual thinking. And it's something that you use to pack your car for vacation, or you used as an architect to design a building, or a technical drawing to draw pictures of parts from different points of view, top, bottom, left, right, side. And so these are the same processes. And visualization. So let's talk about some of the cognitive aspects of vision. One is visualization. The other one is also logic, how to reason and deduce and understand how things go together, how they don't go together, how do you anticipate what comes next, um, and what things belong, what things don't belong. And all of those are very much visually based. And so these are things that are not developed in the child that has a gut problem or is on the spectrum, oftentimes. And these are the things that are missing if you have a head injury or a stroke. Okay, and that nobody sees. And so uh, I think one of the biggest reliefs that patients have is that somebody can confirm that in fact there is a confusion or a deficit there that nobody else picked up, because a lot of times they're told they're okay, you see fine, you'll grow out of it or you'll heal out of it, when in fact that doesn't happen. And 4 or 5, 10 years later, we still got this problem, and nobody seems to want to do anything about it. And so that's not that there aren't good, there's well-meaning professionals. They just, by the same token, they don't know
mhm.
what's missing. You have to do the tests, and a lot of times insurance doesn't pay for all these tests, and so oftentimes they're just not done. And as such, people don't know. And so they are relieved to know what the problem is. And the bigger relief is that you can do something about it. Like I said, it's a learned process, whether you're a developing child or an injured adult or a misdiagnosed adult. Way on. So I really encourage people, one, to see a developmental or behavioral optometrist, see if there's a special prescription, or make sure they got the correct prescription, or there's a special prescription that may facilitate their reading, and then to see if there's something that needs, in terms of training, needs to be learned about how to use their vision in a more effective way that would relate to their needs or problems. And then there's a fourth area that we haven't talked about, and that's the nervous system and the balance thereof,
Mm.
between the sympathetic and parasympathetic, or what's called the autonomic nervous system. And so that's the part of the nervous system that controls heart rate and breathing, um, and is controls all the functions of the body. But it runs in two gears, and this is what's important to understand. One gear is the high gear, which is the fight or flight or sympathetic, and that gear is for action. It prepares the body action. So if you're being attacked by a bear, it gears your body to run away. And so blood flows to the muscles away from the gut. It suppresses digestion, it suppresses immunity, and it suppresses sleep. Okay. And also for vision, it gears the eyes to look far away, to look for danger. And they go, it's not a time that you would read. or do things in it. Behaviorally, it makes you very reactive or jumpy or anxious, okay, to react to danger. Then there's the parasympathetic, and that's just the opposite. That's for healing, that's for digestion, that's for sleep, that's for contemplation. But visually, it's also for reading. It gears the eyes to focus up close and read. And so what's important there is if you have an imbalance in those systems, or it's stuck in the high gear or it's stuck in the low gear, then the child's behavior and health will show that. So if they're stuck in the high gear, they tend to be anxious, they tend to worry, they tend not to sleep well, they tend to have immune problems and allergies, and they don't read well because their eyes are focusing far away. They have a hard time with what's called convergence, the eyes converging up close to read. Okay, and so they can be hyper, and they have a hard time sitting still. And then you have the so they need to be calmed down. We use syntonics or light therapy to calm them down. I'll talk a minute about that. But then in the low gear, these kids are sluggish. They have a hard time finishing their assignments on time. They have a hard time finishing the test on time. They have a hard time exercising. They tend to be a little heavy. They tend to gain more weight more easily. They tend to eat more, but they do sleep generally well. But depending on what they eat, as you well know, if their diet is off, then if they get too much sugar or white food, they can have yeast and toxins there, toxins from the gluten, and all that can suppress the immune system, of which case then they can have allergies too and have immune problem too. So those things are real important. But what's a real godsend is that what we do about it is we rebalance that nervous system such that it's not in the high gear, not in the low gear, but kind of in the neutral gear, so it can shift up when it needs to and down when it needs to. And we use syntonics to rebalance that system. So the hyper kids, we kind of need blue lights to calm them down. The sluggish kids, we need yellows, greens, and reds to ramp them up.
Yeah.
So once you balance that out, generally the kids are just much more responsive, and the adults, to the therapy, or their symptoms are less, and they tend to sleep better, tend to digest better, and tend to think better and see better. So
yeah, so that's something I'm going through too right now, as
right there's
the
one of the
syntonic light
filters.
therapy. So I have the alpha omega and the mu delta. So this, for me, anecdotally at least, has helped me sleep better. I have more vivid dreams. My digestion has gotten better. So everybody's response to this is a little bit different depending on what you're going through. But the syntonic light therapy has helped me tremendously. And I think being able to do, again, taking that holistic approach, being able to balance the sympathetic and the parasympathetic nervous system and help through visualization and really taking a holistic approach to vision is just amazing. Yeah, so it speaks to the kids, the adults, and at any age these things can happen to any of us.
Yeah, well, you're a good patient, Kristan.
Oh, thank you.
So you're doing well. But what's nice about the light therapy is, there's no medication involved, so there's no toxic residue that the body has to deal with. It's kind of a pure energy form, and when appropriately prescribed, it really energizes energizes the body or relaxes the body such that it can perform more optimally than it is. And so we've been doing it about 16, 17 years now, and I still am surprised, just like you saying. And the dreams are important. What's really critical about those dreams, when you call rapid eye movements, is what the term is used, and that's when you're in your most vivid dreams, and that's generally just before you wake up. Although you'll have it several times, you can cycle through them as you sleep. but just before you wake up, it releases growth hormone. And that's the hormone that runs around and repairs things in your body. So when you wake up, you're fresh and you're ready to go. And so without that growth hormone, you're dragging. And so we have a lot of kids that aren't getting a good shot of that growth hormone. Adults too. This is a lot of adults. A lot of adults are quite anxious. I mean, we're in a very anxious time in the country, in the world, and we're bombarded by messages of chaos and alarm, and kids feed off of that. And so do adults, quite honestly. Everybody feeds off of it. And people are much more anxious than they used to be. They're more worried. And that brings to mind another thing that when I went to school, kids don't move as much as they used to. We all don't move as much as we used to. We ride everywhere. Like when I went to school, I'd walk to school, come home for lunch, and go back. And just in the course of transporting myself to school, I'd walk a couple miles. Well, if I was rode to school and just sat there, I'd probably be all jumpy and have a lot of nervous energy. So I was allowed to expend a lot of energy, but also the movement helped me develop my body awareness and body schema, and this is what a lot of kids aren't getting today, is just not moving enough to really understand their bodies, understand the space around them, and be able to visualize and visually and spatially orient themselves to themselves and to the world.
Yeah, and that's one of the things. I just got done doing a training this morning. So one of the tricks that I use to kind of help people during my trainings understand what it's like and how visual problems affect praxis. Because a lot of times what happens in our school age kids, that they are slow to read or slow to be able to finish work, and then they get recess taken away, which is exactly what they need. So it's a double-edged sword. So what I do, if for people watching, is I'll print out a pretty detailed maze, and I will use generally a small hand mirror. And what you do is you place the hand mirror at the top of the maze, and you navigate the maze by looking in the hand mirror. Time yourself for 2 minutes and just see how far you can get. And that gives the attendees in my trainings usually a new perspective. And they're like, oh my goodness, that was something I never even thought of. So any teachers watching this, I'd highly recommend that you try to do something like that, because then it puts things in a new light and helps you understand when you should refer to people like Dr. Lessmann. So yeah, any final points that you want to make to people, and then we'll give them contact information for you?
Well, just to reiterate, vision's more than 20/20. It's important how you see as much as what you see. Vision is learned, and therefore it can be treated. And it's important to balance out the nervous system, as we talked here at the end. And glasses are really important.
Yeah.
You know, so and also the material of the glasses. We can go on and on, but the commercially popular materials are unstable, which is polycarbonate, and it kind of, not only does it degrade over time and in sunlight, but its material is inconsistent, and so I solve a lot of problems just by getting the right material on their eyes. And then metal frames are conductive, and that can be problematic for those with head trauma. So we use plastic frames because they're more inert and better for the body and the eyes. You know, so there's so many things, but the big thing is it's more than 20/20. How you see is just as important as what you see. Vision is learned. Balance the nervous system, and glasses are really important.
Yeah, it's fantastic. Well, thank you for taking the time to meet with me today. If people want to get to know more about what you do and schedule an eye exam, how do they do that, Dr. Lessmann?
Well, one, we call it a vision exam.
Vision exam.
But thank you for that. By the way, you're a great interviewer.
Oh,
So
thank
you. But you can search Vision Therapy Pittsburgh, and the Vision Development Institute will come up, one of the top 3. Generally, you can, but the best thing is to call our office, explain your situation, and then we can set you up for the appropriate evaluation to get you started. And that's 412-731-5007, or our website, visiondevelopmentinstitute.com. All one
Okay.
word.
All right. Well, again, thank you so much for your time, Dr. Lessmann.
Oh,
And
thank
I'm
you,
sure a
Kristan.
lot of people will be reaching out.
Okay, keep up the good work.
Take care.
All right, bye now.